What's up, everybody? Today I'm going to be talking about lurasidone, and I'm going to be telling you its side effects, its main effects, how it works, and basically just everything about it. So, to start off, lurasidone is an antipsychotic, second generation. There are four main generations of antipsychotics. First generation mostly just block dopamine. Second generation have heavy serotonin activity too. Third generation partially block dopamine. And fourth generation don't touch dopamine. So to start, it's made to treat mainly bipolar depression and schizophrenia, and it comes in the doses. Usually you go from 40 to 160 milligrams daily, and it has a long half-life, so you only have to take it once a day. And here I'm going to talk about all the receptors that it hits, which is where you'll get to really know all its side effects and how it feels. So basically, the first biggest one it hits is D2, which is a dopamine receptor. In schizophrenia, it's really overactive, which is what causes the delusions and hallucinations mostly. And by blocking it, it doesn't block dopamine in the way where you can't feel it, but it stops excess dopamine basically. Like you have the baseline right here, and in schizophrenia, your baseline is up here. And if it were to uh, fully block dopamine, like remove all of it, it would be down to here, way below, and you'd be just super depressed and stuff. But instead, it brings it right back to the baseline, and that way it fluctuates a lot less. Anyway, the main side effect of it, well, this is really effective for, like, the positive symptoms, such as hallucinations, delusions, disorganized thinking, but it can sometimes make negative symptoms worse, which are stuff like social withdrawal and flattened emotions and stuff, by kind of dimming things down a bit. And it can lead to something called akathisia, which is basically intense restlessness, where they have this constant urge to move. And that's basically all for D2. The next biggest one it hits is 5-HT7. This is a serotonin receptor. 5-HT7, when activated, it usually makes you feel worse, so lurasidone actively blocks it. And by blocking it, it actually has a very unique effect compared to many other antipsychotics, which don't touch this receptor at all. In fact, lurasidone has the highest affinity for this receptor out of all approved medications. So, basically, this one helps a lot with sleep and cognition. It helps you think straighter, it helps with mood stabilization, and its biggest side effect is it makes you quite drowsy, which is why most people normally take it in the evening instead of the morning, so they sleep through the sedation, and lots of people have trouble sleeping, and it tends to help them fall asleep and stay asleep for longer. The next receptor it hits is 5-HT2A serotonin receptor. This one is the main one that all atypical antipsychotics or second generation antipsychotics hit. It blocks this one too, and by blocking it, it helps increase slow wave sleep and helps with mood and reduces anxiety a lot. And because of this, it also reduces side effects from blocking dopamine, because when you block 5-HT2A, it increases dopamine in certain parts of the brain, which can help, because when you block dopamine with antipsychotics, it kind of just blocks it all over, blocks all the D2 receptors, which can cause issues. And by blocking the certain serotonin receptor, it increases it in places that an increase would help. Anyway, this helps reduce restlessness and anxiety mostly. Next one it hits is 5-HT1A, and this one is the receptor most new novel anxiety medicines hit, such as Busbar, and this one almost purely helps with anxiety, and it helps reduce a lot of anxiety. Side effects is it could keep you a bit more like alert, I guess, but the other receptors it hits helps balance this. It is a partial agonist of it, which means it activates this receptor. This is, I think, the only receptor that lurasidone activates instead of blocks. And next one it hits adrenergic receptors, which are basically adrenaline. And why this is interesting is lots of antipsychotics are purely just sedating, and this one helps keep you alert and focused more. So those are about all the receptors that it mainly hits. Now I want to touch on a bit the receptors it doesn't hit, because this plays a big role. Almost all antipsychotics usually hit histamine, same as Benadryl and sleep aids, which can cause really intense sedation, which makes them just tired all the time, and that's something, it's actually really useful for people who are like really restless and manic, but in the case where it's just purely like psychotic symptoms or depressive symptoms, it actually doesn't help that much. So by not hitting histamine at all, it makes it a lot less sedating than most antipsychotics. Another receptor it doesn't hit is 5-HT2C receptor, which is another serotonin one. And this one, what it mostly regulates is hunger and stuff. And the reason a lot of antipsychotics cause a lot of weight gain is because they block this receptor, and this receptor like signals to your body that you're full and you don't need to eat anymore. And by blocking it, people just have like unquenchable hunger, basically. Now that's all for the receptors it hits and doesn't hit. Now let's move on to the side effects and main effects. So I'll start first with the main effects. When you take it, how it feels is it takes about a week, which is pretty fast for a medicine to kick in. It's not instant, like you won't feel full improvements first time, but you will feel quite sedated at first, which is weird because it doesn't block histamine, but because it has so much activity on serotonin, before your brain can adapt to it, it will make you quite sleepy at first. Within a week, usually hallucinations will slow down, reduce frequency, or stop entirely. But also in this first week is the biggest time where akathisia arrives. The biggest sign is probably if you constantly feel uncomfortable and just have this like strong urge you need to move, like you're like bubbling over with energy. It's a very distressing side effect, and the good thing is it's really easy to treat. You just either reduce the medicine, switch it, or add in extra medicine that blocks it. So it helps with the psychotic symptoms like hallucinations, delusions, but because it also treats depression, its serotonergic activity actually improves mood a lot. It's one of the only meds approved for bipolar depression because it does not increase much of a chance of a manic switch, which is the main reason bipolar people can't take typical antidepressants like SSRIs like Prozac and stuff, because those a lot of times will trigger mania, and lurasidone has a way lower risk of it. So it helps with depression, psychotic symptoms, and focus and memory. Now, onto the main side effects. So the biggest side effects, there are two biggest side effects. Usually the biggest ones are restlessness and sedation. It's not usually referred to as sedation, it's usually somnolence, which is just sleepiness rather than like profound like inability to stay awake. It just makes you feel kind of sleepy. Now this isn't for all people, it's something like 20%. And the worst side effect is definitely akathisia, which it increases with the dose, Unlike some medicines where it's like this, it's exponential, it's linear. So as you increase, your risk of akathisia increases linearly with it. If you're taking it and you notice really intense restlessness, it's a good thing to check in with your doctor really quick because it can be really distressing and it is quite quick, has quick solutions to it. Now, side effects that it doesn't have, unlike many other antipsychotics, is it does not have extreme sedation, it does not cause weight gain, and it doesn't cause metabolic changes either, so you won't get increases in blood sugar and stuff. And another interesting one is a lot of antipsychotics block acetylcholine, which can cause a dry mouth, constipation, and blurry vision. And another issue with blocking acetylcholine is it can actually lead to more cognitive decline, just something you want to avoid, but lurasidone doesn't touch acetylcholine at all. So yeah, those are mostly everything you need to know about lurasidone. If I missed something, tell me in the comments. Thank you, bye.